Over the last 10 to 20 years, therapies have advanced remarkably to the point that we are now able to give patients optimism and a positive outlook. And I think that multiple sclerosis is one of those areas where we've made a huge amount of progress and can really change the disease trajectory. We have so many options that we can guide patients through and help them make the right selection, sort of through a personalized care plan, and really make a difference in their lives such that they're able to continue on with all their goals and aspirations. I'm Christopher Perrone, a clinical neurologist at Penn Medicine. Multiple sclerosis is the primary patient population that I see, but it's throughout the whole spectrum, from whether it be MRI changes or clinical symptoms that are very early on in the diagnosis. But I also see patients who have had multiple sclerosis for many years and help to improve their symptoms. I think that certainly there's always a big discussion in multiple sclerosis regarding the treatment choice that will change the trajectory going forward, the disease-modifying therapy. But there's also a lot that we can do for symptoms and for things that have happened before they come to see me. And so I always like to think that there's something we can do for every patient. We have the unique environment of laboratory science, and clinical space sort of fused in a way where we're gathering data from patients who are helping to push the field forward by contributing to research. And then some of that data goes through the laboratory and we discover things which then we translate over back to the clinical arena. I love seeing a patient succeed in terms of their goals and aspirations that they told me about at the beginning or during the visit, that those things don't change, that they go on to continue the employment that they've always enjoyed. They have the families that they plan to have. Learning about a patient outside of their disease and seeing what they accomplish, I think is one of the most enjoyable aspects of the job.